We begin with the battle over health funding.
Leaders with the Helena's Community Health Center say a federal grant that makes up a large part of their budget will continue through the spring.
But they're still raising concerns about the long-term future of that money. PureView Health Center leaders say the federal agency that administers their grant will be able to keep providing it until May. That money accounts for almost $2 million in PureView's annual budget. Ongoing federal funding for the health centers expired last fall, and Congress hasn't yet approved a long-term extension. Executive Director Jill Steele says uncertainty over the money makes it difficult for PureView to plan.
We want to keep offering services at the same level that we've always offered them. We're even expanding our behavioral health program, and it's hard to do that when you're not sure what to expect for the future funding.
Funding for Montana's 17 community health centers became a prominent political issue this week. Senator Jon Tester said the lack of a long-term appropriation for the centers was one of the reasons he voted against a deal to end a federal government shutdown. Senator Steve Daines supported that agreement. Representatives from Daines' office pointed out that Congress passed short-term community health funding in earlier budget votes. They said he's confident ongoing funding will be a part of an upcoming budget package.
Senators Jon Tester and Steve Daines want the Centers for Medicare and Medicaid Services to explain retroactive fees, which they fear could drive rural Montana pharmacies out of business. Tester and Daines co-authored a letter to the CMS administrator complaining about policies which they say are allowing pharmacy benefit managers to tack retroactive fees onto already soaring drug prices. The senators say the policy is creating uncertain prices that are wreaking havoc with patients, especially seniors on fixed incomes. They argue PBMs are coming back to pharmacies after prescriptions are filled, paying less and forcing patients to pay for the balance out of their own pockets. Sometimes the retroactive fees are charged as much as 6 months after a prescription is filled.
Flu cases in Montana